Before a storm strikes, hospital officials stock up on supplies inside the disaster response trailer, such as first aid kits.
The disaster van can actually serve as a small field hospital, which will encompass treating both medical and traumatic patients. Entailed in the disaster van will be trauma dressings, burn, obstetrical kits, oxygen therapy supplies for a number of patients. It also includes more mechanical equipment like a portable generator, lighting system, portable chainsaws, based on our environment, so we can be multifunctional. It also has a mass casualty management system where we can actually go out there, depending on what the call is requested for, where there's a building collapse, plane, motor vehicle accident, and set up a mass casualty management where patients can be triaged, sorted in the field, and treated appropriately.
One of the key things we learned from Hurricane Ivan is that parts of the island could be cut off geographically, whether from flooding, debris in the road, or whatever. And so depending on which direction we think the hurricane is coming from and the prediction from our weather colleagues, we'll be able to move this trailer to the area we would feel would be most susceptible to being cut off. We have emergency medical centers staged around the island for people to evacuate to or to shelter in, and we have medical supplies pre-staged in those areas as well.
It's extremely important for HSA as one of the emergency responders to always be prepared for any type of disaster. In particular for hurricane preparedness, we have our staff review the hurricane plan as it relates to them and as they are working within the department. And then also we make sure that we teach them about personal preparedness, because it's extremely important for each member of staff to have their personal preparedness plan so that they can reassure that their families are taken care of during a hurricane.
The better your plan, the less likely that something's going to go wrong. We just went through a tabletop drill internally in the hospital. In addition, we had the big drill, the island-wide drill with a hurricane response. And even we have modified things a little bit, particularly with respect to how we communicate both internally and to the national command center with respect to our hurricane response.
We're going to start giving patients 2 months supply of meds automatically. What we suggest is that 1 month supply they put down in a safe container, something with a plastic lid. This is the best time to come for medicine because we order a 6 month supply during the hurricane season as opposed to a 4 month supply. We also have a good storage system. What happened when Dean came is that we got the usual rush, the panic rush just before the storm. And our advice is really normally not to do this.
With women who are pregnant during the hurricane, first thing we advise them is to stay calm. They need to be prepared, get everything they would need for themselves and the babies when they are ready to deliver. What they would have taken to the hospital, have that prepared. We have medical shelters all over the island. So when women who may be close to delivery dates, we advise them to go to the medical shelter where there is a midwife. For women who may be at high risk and 36 weeks high risk where they can go into premature labor, we advise them to contact their OBGYN. With us at Women's Health, they are admitted to the maternity ward. Maternity ward is not equipped to take the whole family. It's just the client who is pregnant.
During the actual peak of the storm, we would not be able to respond outside of the hospital. Within the walls of the hospital, things would continue as usual, with the exception, of course, of any kind of elective things. So we would stop elective surgeries. We would shut down our outpatient services as the storm approached, in anticipation of being able to open up again and provide the services just as soon as it was safe. In anticipation, we feel that it's probably safest to give our dialysis patients, for an example, to evacuate back to the States in case we lose power from the generators. Then we can ensure that our chronic patients, dialysis, and some of our other more susceptible patients with chronic long-term illnesses, we're building an evacuation plan to say, okay, in anticipation, where might we send them?
We've actually strengthened our response as far as our hurricane recovery is concerned, and we've done a number of things in order to put in place contingencies for fuel backup, transport, accommodation.
Since Hurricane Ivan, the hospital has also installed flood barriers to protect its main generator.